To live with aches and pains, but where to start with finding out what's causing your aches and pains can sometimes be a challenge. So we're so happy this morning to welcome back to the show Dr. Nick Circolone from Apple Physical Medicine and Rehabilitation. Good to see you.
Good seeing you, Julie. It's always a pleasure.
We've got a couple of topics we're going to hit on. One that we'll end with, folks might be seeing your commercial talking about something called Stevax,
Yes.
which we'll get into. It's great for chronic pain. But when you're looking at kind of the starting point of the overall health of a person, you've got a new testing, I guess, in place at the office called ANS.
It's an autonomic nervous system testing. You know, what's really cool about this, it's been around for a long time. It's not just, but it's gotten better and better and better over the years. We can test not only the ANS or the autonomic nervous system, but we can also check for blood flow through an ABI. But if you look at the body, there's three basic systems, to make it simple.
Okay.
You have your circulatory system, you have your nervous system, and then you have your digestive system. Well, the brain controls all of that. And ANS, or your sympathetic and your parasympathetic nervous system, what they are is the start and stop. Like your sympathetics are your flight or fight, and your parasympathetics slow things down. So we're able to test for that. We're able to test for blood flow. We're able to see resistance in arteries. We're able to see function of respiration from standing to sitting. So all of these things, there might be something that's underlying that we can find with this test. Most of the time, this test is covered by insurance. It's a preventive test. So what do we do with it once we get it? Well, we look at it, we go through it, we see if there's something that can be fixed with diet or exercise, or if we need to go to the next level and see your family doctor and then keep going from there.
It's been of interest to you, so you put your own self through it.
I did.
You can look at Nick and tell you're in good shape, but even you were surprised a little bit at some things you learned.
I was really surprised. For example, sometimes I'll get some numbness and tingling in my hands or my feet, thinking it's normal. So I went on the test, and you have to have like an 80 to 100% is in the green zone. Well, I had some yellow zones, some orange zones, which are not good. I found out that I have a little bit of insulin resistance. Had no idea about that. But the beauty about the test was I knew that there were things I needed to change, but when I saw the test, it just solidified it for me, and I'm going, wait a minute, I really need to change my diet and start exercising even more.
Well, because you may have thought I need to change in general, but then seeing, for example, the insulin resistance, now that gives you a clear path to know what to do. You talk about the test, though, and the things it can learn. What is it? How are you put through it, and is it invasive? No,
it's non-invasive. That's the beauty part about it. We basically put 3 blood pressure cuffs on you, 2 on your legs, 1 on your arm. We use a pulse ox, which tests your oxygen level. Plus, it has a little bit of it has a small EKG in it. And then we put pads on your feet to check sweat glands and resistance from small fibers.
Okay.
You sit on it, it takes about 8 minutes to take the test, but 20 minutes to start and stop because we have to take you on and off. Plus, we also check it when you stand up. We check your respiration by blowing into a tube for an extended period of time and seeing where we are. And the machine does all of this and calculates it, and we get this beautiful report that gives us information about your body and ways that we can help to decrease the problems going further.
Okay, so since it's a preventive measure, is it something that we should think about, okay, once you're 50, you should go do this, or do you have to have some kind of underlying health concern to get it covered?
No, you don't. Like I said, I had some numbness and tingling. Didn't think anything of it. Sure enough, there was something that I need to work on. If you have numbness and tingling, if you have diabetes, type 1, type 2, if you have any cardiovascular issues, if you have some respiratory issues, these are great tests for you because we can get a deeper view of what's been going on.
Okay, so now let's talk about the chronic pain, because if you're doing the ANS, chances are maybe your pain is not so great, or your problem is not so great that you're really alarmed. If you're living with chronic pain, that's debilitating.
Yes.
And you have this thing called Stevax.
I like that, this thing.
Well, I don't know what, it's a little thing that goes in your ear, right?
It's a neurostimulator.
That's what it is.
Peripheral nerve or field nerve stimulator that we planted in the ear. It's basically, when we say implanted, it's put in the ear for 2 weeks, and then we have a little generator that gets an impulse into that area, which excites the vagus nerve and then helps increase your endorphins to decrease pain. What's really cool about that, though, when we do the ANS test, we can actually see a difference in the sympathetics, which controls your pain, actually drop after we put the unit on.
Okay, so if someone has, let's say, fibromyalgia.
Yes.
Is that something that the Stevax can help with?
Absolutely. Anything that's a chronic pain that's been there for more than, they say 3 months is chronic, but I look for 6 months, years is what we're looking for, because it's more beneficial to the patient. If they're taking all kinds of medication to decrease the pain, what we want to do is we want to help not only get rid of some of the medication that they're taking, maybe not eliminating it totally, but cutting it down considerably so the body can start healing itself.
Okay. I want to let people know too, if I'm correct here, because sometimes a fear of a cost can keep someone from calling.
Oh, absolutely.
The Stevax, we've got 30 seconds left, but the Stevax is covered by insurance, at least with Medicare?
It is. It's covered by all insurances. Some we have to, just like anything else, we have to get it pre-certified, but in 90% of the cases we get it paid for. Now, sometimes we have to fight a little bit longer, but my office fights to make sure that we can get it paid for.
Okay, if you don't know where his office is, they're kind of going through this really beautiful remodeling over on Shallowford Road.
It's so exciting.
Right by the Hamilton YMCA, if you know where that is, and Home Depot, so on Shallowford Road. They also have an office now in Sale Creek.
Yes.
As well. It's kind of a satellite office, right?
Yes.
But the phone number on Shallowford is 855-7376. Within the practice as well, you've got a doctor, an osteopath?
Yes, we have Dr. Solda who's with us. Now we have a new nurse practitioner, Sandra Yoder. She's there a lot of the time. And so what happens is we're able to do a little bit more for our patients by having the nurse practitioner and having Dr. Solda, our DO, there.
And you can read more, find out more if you go to their website, which is applerehabgroup.com. But if you call them, you'll get a real person on the other end of the phone. Thank you, Nick.
Thank you.